Okay, good evening, students. Let me first check whether it's working or not. All those things. Yeah. Never respect me. Okay, guys? Okay, I think it's working. Never respect me. Okay, guys? Okay, I think it's working. Great. Okay. Okay, I think it's working. Okay. It's working. So, good evening, students. So, welcome to the second session on MCQ based. Let me also have, yeah, live chat. Yeah. Okay. So, welcome back to the second session on recent advances. If you remember, yesterday we had a great discussion on recent advances, many of the topics. And today also we'll be taking the discussion forward, students. So, let's start without wasting time. And let's start with the first question, student. Average rural area no, in square kilometer covered by subcenter. Medicine info, hi. So good. Let's have a great discussion for half an hour. Average rural area covered by subcenter as rural health stat as per rural health statistics 2018 and 19 is it is 18.98 square kilometer, it is 19.24 square kilometer, it is 20.21, or it is 17.12, students. This becomes important because we have a new rural health statistics data released, so it becomes too important for you to know, so that you are well versed with the new thing which they have come across. So Venkat Nikhil is answering B. Anyone else who can give a try? Just give a try. This is just for our understanding. No? We should know about that. So the question says, student, let me take my pen. So how much square kilometer area which is covered by sub-center? Okay. So if you can see the options 18.98, 19.24, 20.21, 17.12. You may say that how it is possible to remember the values. Now I'll just tell you the answer is 18.98. Why it will be easy for you to remember, because this rural health statistics is released every year, no, to 2018-19. Now they will be releasing in 2019-20 also. So just have a information about this, because it is asked at times. So what is the rural area in square kilometer covered by the various healthcare delivery system? So for your easy understanding, students, sub-center covers 18.98 as the question was. Primary health center cover, this is in square kilometer, okay? It's the average rural area in square kilometer. It is 120.19, and community health center, it is 559.96 square kilometer. So please remember this. This is the recent as per rural health statistics guideline given by Government of India. New report came, so we need to be well versed with this. So as the question says, question was about sub-center, so it is 18.98. It will be primary healthcare is 120.19, 155.59.96 is for community health center. Now, if we are knowing that, we should also know the average radial distance covered by. Now, the average radial distance covered by, it is a distance. So, if you see for sub-center, it is 2.46 kilometer. For primary health center, PHC, it is 6.8, and for CHC, it is 13.35 kilometers. So this is also for your understanding, because if we know the square kilometer area covered, we should also know the radial distance. This is also as per latest rural health statistics data. Okay. Now we know the population covered, students. We know that subcenter covers 5,000 in plain area and 3,000 in hilly areas. Primary health center 20,000 and 30,000, 30,000 for plain area and hilly areas, and community health center 80 to 1,20,000. But on an average in India, as per the latest data, 1st July 2019, which has been published in rural health statistics, its subcenter caters roughly around 5,616 population, 35,000 is the primary health center, and community health center is 1,65,702. So this I thought to bring to your notice about rural health statistics. You can go ahead and check it also before going for your planning for exams. Just give a revision because you may ask these questions. Average number of villages covered. As you know, subcenter caters 5,000 population, so average number of village covered is 4. Primary health center they cover 26. Community health center they cover 120 villages are there in community health center. So this is also students as per rural health statistics. Okay. Now let's move. The next question is, and I'll request all of you to answer it. The critical determinants of facility being declared as FRU. When is a facility declared as FRU? Is it emergency obstetric care including surgical interventions like cesarean section is there? It is newborn care, blood storage facility on 24-hour basis, all of the above. What do you think? When do you declare a facility as FRU, first referral unit? So Parag has said C. Bala has also answered C. Okay. Anyone else who can give a try? Venkat also D. Venkat has said D. And I can see other people have also joined. They are answering A also. So we have multiple options. So when do we say that a facility is FRU? Now, Parag, those who have answered C, I can understand why you are answering C, because the one of the most critical thing whenever we talk about FRU is blood storage facility. That's true. Now, if you see the option student, and I'll say Raghav, A1, Venkat and Rujuta, they have answered all of the above. Why do you require blood? You require blood storage because there can be requirement in obstetric care, emergency obstetric care. So the moment when you are giving emergency obstetric care, so you may require blood. So all these three are the important critical determinants of a facility being declared as FRU. So if you have these options given, you should go with all of the above. So those students who have answered all of the above is correct. So when do you say a FRU as, when you say a facility is an FRU, it has got round the clock services for emergency obstetric and newborn care. So there are three important criteria. Student obstetric care, including surgical interventions, means there is a facility of cesarean section, means you have obs and gynae specialist, you have a newborn care facility there, and the third one also, because you are going for an operative procedure, so do you have blood storage facility on 24-hour basis or not? If these three is there, then we say that facility as FRU. So these are the three important things which you should always remember. Apart from this, there are other things also, but these are the three critical determinants, as the word goes. Three critical determinants: obstetric care, newborn care, and blood storage facility. Okay. Now, the next question is, students, is under NRHM Untied Grant for strengthening CHC for first referral care is rupees 50,000, 25,000, 10,000, 1 lakh. So what do you think under NRHM Untied Grant for strengthening CHC is what? So Parag is going with D, 1 lakh. Okay. Rujuta is also going with D, 1 lakh. Okay. Anyone else? Anyone else with a different opinion? Okay, Venkat is going with B. So we have multiple options. So students, we are talking about untied grant. No? So untied grant, when we say it is 50,000, it is not 1 lakh, it is not 25,000, it is not 10. So it is 50,000 students. Now let me explain you why there is a confusion here. If you see this, so this is also based on rural health statistics, the recent data shared by Government of India. Now if you see students, when you are going to strengthen health subcenter, so the untied grant is 10,000 rupees. Okay, 10,000 rupees. Annual maintenance grant is 10,000 rupees for strengthening health subcenter. Okay. Second is when you are going to strengthen PHC, the untied grant is 25,000. Annual maintenance grant is 50,000, and RKS, which is Rogi Kalyan Samiti, is 1 lakh students. So total, if you see, it becomes 1,75,000. Coming to strengthening CHCS first referral care. So this was the question. So the untied fund increased from, because it is a community health center, so it increased to 50,000. And annual grant, maintenance grant is 1 lakh, and for Rogi Kalyan Samiti 1 lakh is more. So please remember this 10,000, 25,000, 50,000. Why was there a confusion? Because normally always we read the book, it is always given, it talks about untied fund. So there can be a confusion. So don't get confused. Untied grant is different, annual maintenance grant is different, and Rogi Kalyan Samiti grant is different. So this is for each level of healthcare. For subcenter is this, for PHC it is this, for CHC it is this. Okay, this is the newest guideline, so please remember this. Now, the next question is students, Asha is paid following incentive under ESB for delaying first child birth by 2 years after marriage. So just try, she gets rupees 5,000, she gets rupees 500, she gets rupees 1,000, she gets rupees 1,500. Come on, Venkat, A1, Rujuta is in doubt, 1,000 also he thinks, Parag also thinks about 1,000. So nobody thinks 5,000, nobody is thinking 1,500 if I am not, yeah. So we have a confusion in between this. Now students think in this way, how to remember this, what is this? So let's go with the answer. So it is 500. So those who have answered B is correct. Now how to go? So a couple is married. Now you have a couple. So what Asha's response is 500. Okay. Now after that, the couple has the first child. For example, here the couple is having the first child. After the first child, Asha has got one more responsibility under ensuring spacing at birth, is that the second child, they should have a gap of 3 years. Okay. They should have a minimum gap of 3 years. So if she is able to motivate the couple and maintain the gap of 3 years, again she will be getting 500. Okay. Now the couple has got the first child and they have also had the second child. Now if the Asha is able to advocate and ensure that the couple goes for permanent method of sterilization, permanent method of, they are using permanent method of contraception, for example tube ligation or vasectomy, whatever, then she is entitled to get rupees 1,000. Okay, so this is the way we remember. Now just also see the amount of effort which will be required by Asha. Just a couple is married, so the amount of effort will be required to delay the first child by 2 years. For that she is getting rupees 500. After the first and second child, the gap is of 3 years, she is getting 500. But if After this, the Asha is able to convince the couple to adopt a permanent method, which is limiting method. So she is entitled to get rupees 1,000 because this will require effort. The couple will generally, it is very difficult to convince the couple. So if she is able to get it done, so she is entitled to get rupees 1,000 rupees. So this is called ensuring spacing at birth. Okay. Now the next question is, students, what is IHCI program? It is Indian Hypertension Control Initiative, India Hypertension Control Initiative, International Hypertension Control Initiative, India High Blood Pressure Control Initiative. Can we have the answer, please? What is IHCI program? Indian Hypertension Control Initiative. Shubham Gupta is going with B. Kalpa Ghosh is also going with B. Anyone else? Ajay Kumar is going with B, so only B. Rujuta is going with A, Indian Hypertension Control Initiative. Okay, Prachi is going with D. Okay, Bala Murugan is going with B. So, lots of B. Yes, the IHCI program is India Hypertension Control Initiative, IHCI. Okay, students. So, this is India Hypertension Control Initiative. Now, just try to understand about this program. This comes under NPCDCS. This is under this program because it is only specifically focusing about hypertension. So it is IHCI program. It was launched in 2017, and Ministry of Health and Family Welfare, ICMR, state government, WHO, and Resolve to Save Lives are the technical partners who is supporting this program. You can see this lady. If you can see this lady, she is the Secretary to Government of India, Preeti Sudan. This is Dr. Swaminathan. She is Deputy DG of WHO. This person is WHO representative to India, and he's also some secretary. I don't remember his name, but he's some secretary. So they launched this program, IHCI. What is the importance of this program? They are trying to use evidence-based treatment. What is this evidence-based treatment? As you know, students, to treat hypertension, you require a specialist, definitely MD medicine or super specialization. MBBS doctors are reluctant in prescribing drugs because they think it is very complicated. So this India Hypertension Control Initiative is based on WHO heart strategy. So this is basically on evidence-based treatment. What is this evidence-based treatment? They are giving simple evidence, flow chart, what should be used when your blood pressure is high. For example, I'll just give you an example. If the blood pressure or systolic blood pressure is 140 or more, or diastolic blood pressure is 90 or more, then take two readings. If it is at both the readings it is more, then there are 4 or 5 alternative protocols. So government is saying just start with amlodipine, just amlodipine 5 mg. Okay, once give this for 30 days. So once you give this for 30 days, again call the patient. If the blood pressure is controlled, good enough, continue with that. If the blood pressure is not controlled, students, increase the dose of amlodipine to 10 mg. So what they have done, they are using CCB, calcium channel blocker. Again, give this 10 milligram dose to those people whose blood pressure is not in control. Call after 1 month. Again, if it is not controlled, add ACB, angiotensin converting enzyme blocker, or that telmisartan group of drugs you can add here. So again, if you cannot, you increase the dose. So this is what evidence-based protocol treatment is formed in India Hypertension Control Initiative. So this is the first thing. Second, there should be regular supply of the drug, because in government, in the PHC, you have to ensure that there is a regular supply of drugs. Task sharing is basically the doctor. It is not possible for the doctor to measure the blood pressure every time when the patient comes for the treatment. So the task sharing can be done by the paramedics. Also, when the drug has to given the same drug, the doctor just not have to see, just the paramedics can also dispense the drug under close supervision of doctor. Patient-centered care, you have to record the blood pressure. Now they are offering a digital blood pressure so that you don't have to go with the process of measuring with that sphygmomanometer. And lastly, information system. How much controlled status, how many people who are taking drugs are in controlled state, because today, as of now, hypertension is the leading cause, it is a silent killer, leading cause of death. So the government has come up with this program called IHCI, India Hypertension Control Initiative. Okay, students. Now, this is the easiest one. I just kept this. MCH Subcenter means type B subcenter is when number of deliveries at the subcenter is 20 or more in a month. Number of deliveries at the subcenter is 10 or more in a month. Number of deliveries is 30 or more in a month. Number of deliveries at subcenter is 25 or more in a month. So Parag, I can see he has answered A. Students, other, please give a try. When do you call a subcenter as MCH subcenter? Venkat Nikhil has also saying A with a question mark. Any other students? Mehbul is saying number dual is 25. Okay. Bala Murugan is saying C is 30. Okay. Subham Gupta A. So we have multiple answers. Students, number of deliveries at subcenter is 20 or more in a month. We'll just take this criteria 20. Okay. So just take any subcenter where the delivery load is 20 or more. We'll go with A. Okay. Right. The next question is, students, under Ayushman Bharat, Health and Wellness Center is expected to deliver how many services? Is it 10, 11, 13, 12? Just give a try. Under Ayushman Bharat, Health and Wellness Center is expected to deliver how many services? 10, 11. So Shubham Gupta is going with A. Anyone else who can give a try? I can Bala Murugan A. Others, Parag, Mehboob. Mehboob is going with D. So we have second option. Okay. D. Okay, he is from, somebody is from Nepal, so he doesn't have any idea. No problem. Under Ayushman Bharat, this is a flagship program of Government of India, and it has got two components, as you all know. First is Health and Wellness Center, where through which we give comprehensive primary health care, and the second one is Pradhan Mantri Jan Arogya Yojana, which is the insurance scheme. So the question is about Health and Wellness Center. Students, from now onwards, center will grow on you wherever you work, whether you are doing PG or wherever you are involved. This Health and Wellness Center will come to you. So always, and there will be people who will be talking about Health and Wellness Center. So being a medicos, we should know about this, because this is a flagship program. The answer is 12. Just 12 services are expected to be discharged through Health and Wellness Center. So always go with 12. Those who have marked 12, they are correct. No 10, no 11, no 30. We have to be very specific in this. It is 12. Now let's try to understand how to remember this 12 services. It is very easy, student. As we know, we start always with pregnancy. So just give care in the pregnancy and childbirth. Newborn, second. Childhood, third. Childhood and adolescent. Family planning, contraception. So pregnancy will lead to newborn, birth. After birth, there will be childhood and adolescent. Then again, there will be requirement of family planning, contraceptives. So once you are done with this 4 thing, which was also given before also at the health sub-center PHCs. It was not that it was not given before. It was given before also. Management. Then after this RMNCH component, then they have communicable disease, which is the 5th one. Okay. Management of communicable disease, including National Health Program. Then OPD, no, common communicable disease OPD will be also given through this. OPD, this is sixth. Then you do screening of NCDs. So see, from here now they have started adding the new things. Seventh is NCD screening, ENT and eye problem solutions, oral health care, elderly care, emergency medical services, and mental health. So all this, if you add students, so it becomes 12. So how to remember this 12? RMNCH, RMNCHA will form your four services. Then you go with communicable disease where you have two things. Then you go with NCD, go with ophthalmic, ENT, oral health, mental health, emergency, and elderly healthcare services. So it makes into 12. Just try to practice by saying this way. This no need to remember. You have to remember 12. You have to speak about 12 services, and it is easy. Talk about pregnancy, talk about newborn, talk about childhood, talk about adolescent, talk about family planning. That finishes RMNCH. Then talk about communicable disease, National Health Program, simple treatment or some common communicable disease treatment, NCDs, ENT, eye, oral health, mental health, emergency, and elderly care. That makes to 12. So no need to worry how to remember. As the severity goes in India, if you put in that way, you will be able to answer all the 12 services. Now, what is the change? Subcenter, if you remember, when you think about subcenter, it always talks about RCH, reproductive child health, mother child and all that. Now, through this health and wellness center, they have added other things also. No, NCD has to be taken, mental health has to be taken, elderly care has to be taken, emergency care has to be taken, oral health care has to be taken, ophthalmic ENT has to be taken. So that is based on epidemiological transition. Nowadays, 62% of death is due to NCDs, and your system is only focusing on RMNCH. How is it going to work? It's not going to work. So this is the concept of health and wellness center. And this health and wellness center students, you will always hear this word nowadays, CPHC. What is this? It is comprehensive primary health care. Okay, let's move. As per SRS Bulletin 2015 and 17, MMR, which is maternal mortality ratio of India, is what? It is 123, 122, 130, 120. Just give a try, students. Venkat is answering 130. Bala Morgan 122. Madin, okay, there are many C's. Parag is also answering C. Ravi Gupta C. Now students, why you are answering C? Because of late we were, this 130 is 2014 to 16 MMR bulletin. So we'll go with 122. So the current maternal mortality ratio of India, if anybody asks you, is based on 2015-17 SRS data, it is 122 students. It is not 130. 130 was before this, means 2014 and 16 MMR, that SRS bulletin. Okay, just see. Maternal mortality ratio, if you see current 2015 and 17, India is at 122. The highest maternal mortality ratio is Assam, 229. Okay. So please, whenever nowadays if they ask you what is maternal mortality ratio, just go with 122. It is not 130. 130 was before this, means 2014 and 2016. So always go with this 122 nowadays. Okay. The best way of just getting getting information about this is, students, everybody has now smartphones. Whenever you get time, whenever you're thinking about community medicine, whenever. So what you do, just SRS bulletin, just type SRS bulletin. If there will be a new bulletin, you will be able to access to that and you will get the information. If there is no new bulletin, then you know that okay, we are till 122 only. So nowadays you never know when they come. Every 6 months they can come out. So just be prepared. They can come up with new guideline also. We will be there to help you out, but you can also check. It's not that you cannot check. You can also check by that SRS bulletin. You can go and you can check it. The next question is, which point of care test is endorsed at basic part of healthcare system of India by WHO and ICMR in diagnosis of TB? Is it TrueNat? It is CBNat, LPA, line probe assay, or none? So Parag is in between this. Venkat is A with a question mark. Others, Mehboob is with B, CBNat. Anyone else who can give a try? Just give a try. Now, if you read the question, we all know about CBNat. We know about line probe assay. You may have heard about TrueNat. So the question is how to answer which question. But if you go to the question, that will help you to answer it. Which point of care? Now read this line. What is this? Point of care test means where you are providing care, there only you are doing the test. Point of care test endorsed at the second important part of the question was basic part of healthcare system. Now basic part of healthcare system is what? PHC, CHC. It is not district hospital, it is not medical college. So basic part of healthcare system is at the block level or below that. So at the block level, at the PHC, CHC, what type of point of care test is endorsed? Is it CBNat? No, it is not possible. Is it line probe assay? No, it is not possible. Go with TrueNat. Why you don't go with TrueNat? Go with TrueNat. It is a very important, innovation, intervention. And why this is important, students, for us? Us means India, because this has been developed by India. No, India developed it. This CBNat LPI is not Indian developed, but this TrueNat India has developed. Now, what is the importance of this TrueNat, students? It's a new molecular test. Okay, it gives diagnosis of TB in 1 hour. Okay, so if you remember, CBNat also give within 2 hours. So TrueNat is also giving diagnosis of TB in 1 hour, as well as it also give information about resistance to rifampicin. So the first point is this. Second, the sample 0.5 ml of sample is required, as 1 ml of sample is required in Gene Expert machine. So this is also beneficial. Now it is battery operated and portable. So it is a small machine, battery operated. You don't require a big electricity system. So this can be used at point of care test. So this is called POC. Government of India is emphasizing to ensure that we have TrueNat at the ground level, so that it helps us to diagnose TB at the early. It doesn't require electricity, okay, and it is a point of care machine which is fully automated, and it is portable also. Okay, now, so this will be the last one, students, for you, and I think everyone will answer. How many polio virus strains has been eradicated? It is all WPV 1, 2, 3. Is it only wild polio virus 2? Is it wild polio virus 3? It is WPV 2 and 3. Bala Murugan is saying only WPV 2. Let me see anybody else who can give a try. A student from Nepal. Can you give answer, because it is not related to India, it is global thing. How many polio virus has been eradicated? Mehboob is also saying B. Okay, he is also saying B. Why, students? Why only B? Why not this? Yeah, Ravi Gupta goes with D. Very good. Parag is also going with D. Very good. Venkat is also going with D. Prachi is going with A. No, one has not been eradicated. So, students, it is 2 and 3 both. 2 was eradicated in 2015, certified. So, just this slide will help you to ensure, to understand. On 17th October 2019, see this 2019. What is this? We, the member of Global Commission for Certification of Poliomyelitis Eradication, conclude today, which is 17th October 2019, that indigenous wild polio virus type 3 has been eradicated worldwide, and this is by WHO. So we have eradicated wild polio virus 3. We have already eradicated type 2 in 2015. So the last case of polio virus 3 type 3 was in Nigeria, Ruksar, 13th January 2011 in India. We are talking about India, which has been eradicated, students. I'll just give me on Unacademy platform. I take a plus course. Today also I have a class. Those who are plus members, I am taking a capsule course on communicable disease part 1, part 2, part 3. I am also involved in foundation course where I will be teaching the entire community medicine. So, Unacademy platform gives you, unlimited access to all the courses. There are different educators, tests, PDF material, batch courses, mentorship, guidance, live test series, regular doubt clearing sessions are there. So, I'll advocate that you can join, students. These many educators, including to me also. And the next class, Parag and till 9 a.m. to 9:30 will be taking about national health programs. From 10 o'clock, 10 to 11 and 12 to 1. 2 classes back to back on biostatistics, which was left as you are asking. And second is we'll be also taking numerical based questions. So on Friday 9 to 10 I'll be taking YouTube 9 to 9:30 YouTube class, and 10 to 11 questions, students. Okay, so it was a great discussion, students. Thank you for joining. And just recent advances topics are important. We should, and this is a platform where I also bring questions so that you should be well aware with many of the topics, so it helps you to remember things. Okay, that note, students, thank you very much for joining. Take care.